than the medic. Welcome to another lecture in the lecture series. Today we are going to be talking about arterial hypertension. The definition of hypertension actually varies. On the one hand, you have the ISH saying that hypertension is considered as systolic blood pressure that is greater than or equal to 140 millimeters of mercury and or diastolic blood pressure that is greater than or equal to 90 millimeters of mercury. While in 2017, the American College of Cardiology and the American Heart Association defined arterial hypertension as persistent systolic blood pressure of greater than or equal to 130 millimeters of mercury and or diastolic blood pressure of greater than or equal to 80 millimeters of mercury. It's important to point out that this particular classification is still used in the US, and that is why in the US almost 1 in every 2 individuals have hypertension. It's because there's a lower threshold for measuring hypertension. Hypertension in children is defined as blood pressure that is greater than or equal to 95th percentile or greater than or equal to 130 millimeters of mercury for systole and then 80 millimeters of mercury for diastole, whichever of this is lower, which means that if you measure the blood pressure for the age of the child and you see that it is in the 95th percentile and then it is actually lower than 130/80, you use that value instead to deduce that this child has arterial hypertension. So it varies for children depending on the age. So we also need to know the definition of primary hypertension. Primary hypertension is the hypertension that has no identifiable cause, while secondary hypertension is the kind of hypertension that has an identifiable underlying condition. Now, it's important to point out that the primary hypertension is the most common kind of hypertension and it accounts for about 90% of all hypertension cases. Then we also have resistant hypertension, which is the kind of hypertension that remains uncontrolled despite treatment with greater than or equal to 3 antihypertensive medications or requires greater than or equal to 4 medications to be controlled. Then you remember from the beginning I said I was going to use the latest classification of hypertension. So this one was provided by the International Society of Hypertension, and they classified normal blood pressure as systolic blood pressure that is lower than 130 millimeters of mercury and diastolic blood pressure that is lower than 85 millimeters of mercury. I would like to remind you that the optimal blood pressure is SBP less than or equal to 120 and DBP less than or equal to 80. Then the ISH classified elevated blood pressure or prehypertension as systolic blood pressure that is between the range of 130 to 139 millimeters of mercury and or diastolic blood pressure that is between the range of 85 to 89 millimeters of mercury. Then stage 1 hypertension is systolic blood pressure that is between the ranges of 140 to 159 millimeters of mercury and or diastolic blood pressure between the ranges of 90 to 99 millimeters of mercury. Then stage 2 hypertension is defined as systolic blood pressure that is greater than 160 millimeters of mercury and or diastolic blood pressure that is greater than or equal to 100 millimeters of mercury. Now in some textbooks you will see an extra stage 3 hypertension, but this is not like in the official classification by the ISH, but I just thought I would put it here. So stage 3 hypertension is when your systolic blood pressure greater than or equal to 180 millimeters of mercury and or diastolic blood pressure greater than or equal to 110 millimeters of mercury. So as for the epidemiology of hypertension, hypertension is actually a pretty common disease. It affects about 1.3 billion people worldwide. And like I said earlier, primary hypertension accounts for approximately 90% of cases of hypertension in adults, and the prevalence unfortunately is increasing in children and adolescents. Then secondary hypertension accounts for about 10% of cases of hypertension in adults. The prevalence of hypertension increases with age. One of the risk factors for hypertension is actually advanced age. Approximately 65 to 75% of adults develop hypertension by 65 to 74 years of age. In some studies carried out in the US, it was seen that hypertension was highest in the African American community, followed by individuals of Caucasian descent, and then it was lower in the Asian American and Hispanic community. Now, the reasons for this are not entirely understood, but there's a theory that states that the psychosocial, environmental, and also some related behavioral factors are considered to be responsible for the higher prevalence in African Americans. Approximately 60 to 87% of overweight and approximately 73 to 95% of obese patients are affected by hypertension. Now, of course, we know that it is more prevalent in men than in women, but that's for people that are below the age of 65 years. After menopause, the prevalence increases in women. I explained this in my previous video on atherosclerosis. It's also important to point out that when a woman gets to about 75 years of age, the ratio between men and women developing hypertension becomes on the women's side, meaning that women will become at higher risk of development of hypertension when they get to 75 years of age. Now, as for the etiology of primary hypertension, it's a multifactorial disease that consists of different etiologies, including epigenetic, genetic, and environmental factors. And this kind of hypertension is directly related to total peripheral resistance and cardiac output. So there's no underlying cause for this hypertension. The cause is because of what happens in the vessel. So as for the risk factors of primary hypertension, we have the non-modifiable and then we have the modifiable risk factors. As for the non-modifiable risk factors, positive family history, because we can't do anything to change the family history, unfortunately, race and ethnicity, and also advanced age. Then as for the modifiable risk factors, it includes overweight and obesity, uncontrolled diabetes, smoking, excessive alcohol intake, diet high in sodium and low in potassium, physical inactivity, and also psychological stress. Now, the etiology of secondary hypertension, if you remember, I said secondary hypertension is caused by an underlying identifiable disease. So, when someone has renal disease, this can actually result in secondary hypertension. In the case of renal artery stenosis, also it can result in secondary hypertension. Pheochromocytoma, secondary hypertension. Hyperthyroidism, hyperaldosteronism, hypercortisolism, obstructive sleep apnea, raised intracranial pressure, and then some drugs like sympathomimetics. Unfortunately, I won't be able to go through the pathogenesis of hypertension in all these diseases, but I'll try to link some resources in the description. In most cases of hypertension, it's usually asymptomatic until we have complications of end organ damage, like for instance in the case of hypertensive crisis. I want to let you guys know more about hypertensive crisis. Hypertensive crisis is actually like when there is an acute increase in blood pressure, and then this hypertensive crisis can be divided into two. We have hypertensive urgency and hypertensive emergency. Hypertensive urgency is when this increase in blood pressure is not accompanied by any end organ damage. But hypertensive emergency is when we have end organ damage. accompanied with this hypertension. As for the clinical features of secondary hypertension, it usually manifests with symptoms of the underlying disease. As for the non-specific symptoms of hypertension, we have headaches, especially in the early morning, or waking headache, dizziness, tinnitus, blurred vision, flushed appearance, epistaxis, chest discomfort and palpitations, strong bounding pulse on palpation, nervousness, fatigue and sleep disturbances. So, how do you actually prevent hypertension? I'm pretty sure you remember I talked about modifiable risk factors when I was talking about the risk factors for development of hypertension. So, since these are the modifiable risk factors, these are the actual things that we should actually try to control. So, if someone is obese, all the healthy weight reduction techniques should be employed in this case. So, modification of diet, physical exercise, and also bariatric surgery if the person cannot lose weight. Then also, if the person is diabetic, control diabetes. If the person is a smoker, try to reduce smoking. So basically, you tackle all the modifiable risk factors because these are the ones that are within our control. So these are the ways to prevent hypertension. So the complications of hypertension is divided into different systems. So due to hypertension, some cardiovascular defects can occur. The cardiovascular defects include left ventricular hypertrophy, also hypertrophic cardiomyopathy, congestive heart failure, coronary artery disease and myocardial infarction, atrial fibrillation, aortic aneurysm, aortic dissection, carotid artery stenosis, PAD or peripheral artery disease, and also atherosclerosis. If you remember from the previous lecture, I said atherosclerosis forms based on the fact that there are microscopic tears in the intima. So, hypertension is known to also cause microscopic tears because of the increased pressure. So, this can also lead to formation of atherosclerosis. And also, there can be complications in the brain, of course, stroke. In this case, it will be hemorrhagic stroke because the pressure can burst the artery open. In the kidneys, we have hypertensive nephrosclerosis, which is as a result of chronic hypertension, and then chronic kidney disease too. And as for the eyes, hypertensive retinopathy. Now, due to the nuances that are associated with treatment of people that are hypertensive with different comorbidities, and then also with pregnancy and some other conditions, I would refer you to the 2020 ISH guidelines. I'll leave the link in the description. And then all the other subtypes and variants of hypertension I didn't talk about will also be found in these guidelines. That's the end of the video. Be sure to leave a like and subscribe if you haven't.